Thank you and welcome to the show this morning. The topic this morning is spirituality, depression, and suicide. And we're fortunate to have with us to talk about spirituality, depression, and suicide, Dr. CPoe. Of course, Dr. Poe, we've had you on so many shows here, and I'm sure that most of our audience is familiar with Dr. CPoe, and they, like I, can expect a lot of good information today. And what we'd like to do today, Dr. Poe, is to talk about this area of spirituality, depression, and suicide. But before we get into that, let's have you to give us some information about your background, your education, and some of the things that were important in terms of eventually leading you to become involved in some of the areas that you're now involved in. And then we'll talk about these three issues of spirituality, depression, and suicide.
First, let me just say that it feels good, and I'm very thankful to have the opportunity to join you on your show again. I finished Tennessee State University in 1960 and went to Meharry and finished Meharry in medicine in 1964, took an internship in Chicago, did a residency in psychiatry in Berkeley, California, and then went into practice in Berkeley. Then I came back to Nashville in 1976, worked at Meharry for a while in the Department of Psychiatry, and then went into private practice. Got involved in prison ministry, got involved in homeless ministry. I've worked at Middle Tennessee Mental Health Institute. I've worked at 3 or 4 different hospitals in small communities in Nashville. And so over a period of time, I've interviewed quite a few people who were acutely depressed, despondent, in despair, and who were suicidal. And so the Lord led me then, or gave me an opportunity to write a chapter on suicide for a book called Counseling in Afro-American Communities, published by Zondervan Press 2002. And so that led to some opportunities to talk about suicide.
Very good. And of course, the topic this morning, Dr. Poe, is spirituality, depression, and suicide. Let's have you to look at these three elements and to, over the course of this program, to sort of interrelate them or bring about some conclusions in reference to them or whatever the way that you wish to do.
Okay. The research shows, Dr. Haney, that there's an inverse relationship between spirituality or religion and suicide. The more religious a person or a community or a nation is, the lower the suicide rate. Interesting enough, Spain has is considered to be the country with the lowest suicide rate, and Italy has a very low suicide rate. Well, we know that in Spain, the state religion is Catholicism. We also know the strength of the Catholic Church in Italy. And so there's an inverse relationship between spirituality, religion, and suicide. On the other hand, if you look at the statistics regarding suicide prevalence in the U.S. among the 52 states, and also including the District of Columbia, that's regarded as a state, Nevada has the highest suicide rate. And Alaska is second. Now that's according to statistics in 1997, but according to the statistics in 2002, Alaska #1, Wyoming #2, Montana #3, and Nevada #4. Now on the other end of the spectrum, in terms of the states with the lowest suicide rate, you find Washington D.C. has the lowest, New Jersey second, and New York City 4, and I think it's Massachusetts or Rhode Island 5th. Now, you and I know that Afro-Americans traditionally, historically, have had a strong religious orientation, and so where you find persons who have a strong religious orientation, almost always you're going to have a low suicide rate. So that tells us that there's something about suicide and religion that needs to be examined.
Good. Now, in examining this issue of suicide and religion, where do you start when you look at these two as issues?
Well, for example, we know that a lot of people don't kill themselves because of what's considered to be the religious taboo. The religious taboo says that if you kill yourself, you're going to hell. And I've had many patients tell me, no, I'm not. I have these thoughts of wanting to kill myself, but I'm not going to kill myself because I don't want to go to hell. All right? And so that's a strong inhibition. But in addition to that, though, the religious person, the genuinely religious person, most likely is not going to abuse alcohol, most likely is not going to be adulterous, most likely is going to basically try to be guided by the golden rule, which says treat other people like you want them to treat you. That insulates them or reduces the intensity of their guilt.
Now, which also brings us into that area of spirituality.
Yes.
And of course, what we'd like to do now, Dr. Poe, is to take this first commercial break.
Okay.
After which we'll come back and we'll give you an opportunity to bring that into spirituality. And we'll be back with our audience following this very, very short commercial break. The topic is